And as soon as she walked in, she just gave me a big, tight hug and said, I just feel great. You've changed my life. Thank you so much. So that those type of feedback that we get from our clients.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Irina Hahanov and Don Duane of Bliss Medical Spa. Irina is a dedicated and compassionate family nurse practitioner and co-owner of Bliss Medical Spa and Wellness. She holds a Master's of Science in Nursing from Grand Canyon University and is an active member of the American Academy of Nurse Practitioners. With a deep-rooted passion for helping others, Irina finds true joy in seeing people feel confident and comfortable in their own skin. Her goal is to blend her extensive healthcare experience with a personalized approach to aesthetic and wellness care. Dawn is the co-owner of Bliss Medical Spa and Wellness as well, and a board-certified family nurse practitioner. She also holds a Master of Science in Nursing from Grand Canyon University as an active member as well of the American Academy of Nurse Practitioners. With a deep passion for aesthetics, longevity, and functional wellness, Dawn takes pride in helping clients look and feel their best. She believes in a highly personalized approach to care, creating individualized treatment plans tailored to each person's unique needs and goals. So Irina and Dawn, welcome and glad to have you here.
Thank you.
So let's dive into it. How did you both get into the aesthetics industry?
It started, we met probably
12, 13 years ago.
and we were working together in the hospital. And then we both started graduate school with the sole intention of opening our own practice. And we just wanted to be able to treat people and help them while they're still feeling well and make them feel the best version of themselves. And so that was what initially started us down this path. And we worked towards that goal, and here we are.
Now, in your introduction, we talked a little bit about functional wellness, which I think is something that doesn't traditionally go with aesthetics, the aesthetic industry. But I'm starting to see more and more of practices bringing in this more holistic viewpoint to aesthetic medicine. But I think yours is a little bit different, where you actually have that functional medicine background first, and then bring that already into the aesthetics world. So you talk a little bit more about what is really, I guess, first of all, what is functional wellness, functional medicine, and how do you incorporate that into the aesthetic side?
I think that it's looking at the individual completely, and it's not just looking at lab work and treating along traditional medicine lines or trains of thought. And so, with that in mind, we will do a lot of, can draw labs and we'll treat based on what the patient themselves is telling us. So, we don't just take the lab numbers themselves and treat everybody the same. We're going to listen to each individual that comes in the office and treat according to their goals and how they're feeling at that moment, and what they're wanting to achieve and their overall well-being. And so I think we take a more holistic approach, and we don't always just fall along the lines of traditional medicine, which I think is more important nowadays. I think we're realizing that there's more outside of the traditional medicine train of thought as far as treating people and helping them feel their best.
Got it. Now, what would you say are some of the most common treatments that your clients and patients come to you for in practice?
I would say it's a combination of everything. We started with a weight loss. That was a high population that people wanted to treat or get, better state. And then when we started, adding more things to our practice, like a hormone treatment, replacement pellets and stuff like that, and, allergy testings. And people just were losing weight, wanted to feel great, wanted to add more things. And I think combination of everything, looking at each individual, um, I feel like hormones, weight loss, and then plus on top of that, once they feel great, more energized, they want to do more of an aesthetic stuff now that they feel great inside, they want to look great outside.
Yeah,
Yeah.
it all goes hand in hand.
Yeah.
It seems like it helps them feel again their best version of themselves.
Mhm. For the weight loss, are you talking about the GLP-1s or that's a big part of that goes into it?
Yes.
Okay. And then on the hormone side, I actually want to dive a little bit deeper into the hormone side because this seems like it's becoming more and more prevalent, but I think that some people kind of know what it is, but also don't really know what it is. So would you mind explaining a little bit more of what is hormone replacement therapy, what goes into it, and really in what situations would someone want to look at this as a solution?
So bioidentical hormone replacement is hormone replacement that most closely matches our own body's production of hormones. And so here, there's a number of treatment modalities. You can use pellets, which is probably one of the more superior methods. There is also injections, there are creams that you can use, oral medications as well. So it kind of depends on what you're replacing as far as the modality and what the patient is comfortable with. And the people that you would treat are, I mean, it can treat so many things. It can treat mood, it can treat libido, brain fog, heart. There's a lot of cardioprotective effects of treating people that are deficient in certain hormones. And you got to think when we draw labs, it gives us a guideline, but these labs are of population of people. And if you're on the lower end of like a lab marker, like your thyroid hormone or your vitamin D, you're probably going to feel probably miserable or not so great, where you really want to optimize those levels. So you don't want to be on the lower quartile of a lab value when, vitamin D, for instance, if you're in the greater than 75% quartile in that, you're going to have immune benefits. You're going to have, again, protection against certain cancers. There's some studies show even brain health, so help prevent against Alzheimer's or dementia. So all these people that come in, they might suffer from depression. At once their hormones are optimized, they're going to feel better in all these categories. So there's a lot of benefit for just about anyone, I would say, to feel better or utilize hormone replacement.
Okay. There's one thing about hormone replacement. I would think about, oh, for men, it's testosterone. If your testosterone is low, then you want to get
Mhm.
more testosterone, or if you're a female, maybe be estrogen. So is hormone replacement therapy um, single focus? Where it's like, oh, I'm a guy, I probably need testosterone. Maybe I do, maybe I don't, but it's just testosterone. Or for a woman, it's just estrogen. Or are you looking at really the full panel? Like you kind of mentioned that, hey, if you're low in vitamin D, you're low in this, you're low in this. And then the hormone replacement therapy would kind of give you that full panel of what you're missing. So is it singular or is it more broad and more far reaching than that?
More broad. We actually do look,
Mhm.
we do order a more broad of lab to review and then go over with the patients. It's not just the hormones, it's also vitamin D levels, like Don mentioned, which is very important to optimize as well. And then free testosterone is important to keep it up as well, not just the testosterone. So it's a more broad of a review.
Yeah. And men are, yes, typically it'll be low testosterone for men, but women it'll be estrogen and progesterone that you'll be replacing. They can also have testosterone, which is really overlooked because there's not a limit that we know that is what women should be at. It's not something that's been commonly replaced or I mean, it is nowadays, but it wasn't before because there's so many women that have lower levels of it. So women actually feel a lot better if they do get some testosterone replacement. So typically that will be something that's added for women as well. And it is at lower levels, of course, than men, but it's still something that would be done.
Okay. And are there are there common situations that you see that happen most often, like a deficiency in something? Like is it vitamin D? Is it testosterone in men? Like are there certain things that you see that this is the most common issue? I'm assuming since you're in Arizona that maybe vitamin D is not necessarily the biggest issue. I'm sure that there's some that just aren't out in the sun, but I would imagine that someone in Arizona versus someone in Seattle, someone in Arizona wouldn't have as much of a vitamin D deficiency would be my guess. But are there some commonalities that you're seeing in what people are deficient in?
So, contradictory to what you're saying, actually, we find very low vitamin D levels in most people in Arizona. You would think that what you're saying is true. It makes sense, but what happens is people stay out of the sun or they put the sunscreen on. So they're actually, I'd say majority of my patients are low in vitamin D. And this is a perfect example of where traditional medicine doesn't, that is like not on the lab panels that your primary care doctor would normally order. And it really should be. It should be something that everybody should be replaced in if they're low. So vitamin D, yes, is probably the most common. When we're drawing all these hormone levels, thyroid levels is another thing that we're looking at to make sure those are in a good range for somebody. So yeah, that's I'd say
Yeah,
vitamin D is
this
probably one of
is,
the biggest.
I
Yeah.
haven't seen anyone actually from my patients,
Hmm.
clients with the normal vitamin D levels.
Yeah, or optimized for
Yeah.
that matter. Hmm.
Hmm.
Well, I guess I probably should have known that was coming because I'm in Los Angeles and like when I got tested, my vitamin D was low for living in Los Angeles. So I'm like, I probably should have known this was your answer was going to be that. So, but I'm also curious, like for people that really need hormone replacement therapy, in what type of situation would they be in for them to even consider this? Because I think most people, it's like they just kind of go throughout their day, throughout their lives, and maybe they feel bad, maybe they feel okay, but like that's how they feel most of the time. So, in what situations would they be? I guess what symptoms would they be experiencing before it's like, hey, you should check this to see if you need hormone replacement therapy? What are some of those most common symptoms that you see in your clients and your patients where it's like, hey, you should at least take a look at this?
I kind of spoke about it before, some of the things that it would treat, and pretty much it's going to be like brain fog. They might feel fatigued, they might have low libido, forgetfulness, feeling depressed or moody or irritable. Like some women, another thing that they might experience is just feeling like they're going to, you know, kill somebody just for saying the wrong thing. You know what I mean? They get that angry or irritable and they feel a little out of control. They might feel a lot very emotional for no reason. It doesn't fit, what is going on in their day. And so all of those reasons, I would say,
Yeah.
yeah, fatigue.
Okay.
Hmm.
And would you notice that there's really,
Subjective.
oh, sorry?
It's very subjective. Like those are all questions you would want to ask like somebody.
See.
Mhm.
And are there any symptoms that you tend to notice more in males versus females, or are the symptoms pretty broad across both sexes?
It's pretty broad.
It's pretty
Yeah,
broad,
I'd
yeah.
say it's pretty broad across both sexes. Hmm.
Okay, got it. Now, I also want to dive a little bit into how you educate your patients on really the benefits of these treatments, or even like we're willing to start. I'm sure that you get a lot of people that ask a lot of questions about what does this do? Do I really need it? Like, what
Hmm.
do I need? So, what's your approach to how you educate your patients on this?
So we start, patients do come in and ask, having conversation during the appointment time, they do bring it up, feeling fatigue, tiredness, and stuff like that. Foggy brain. They're just feeling like they were run by a truck. Um, so, and then that's where we come in and talk about, about the labs values. Let's check your hormones, and then we educate the benefits of it. Some of the patients feel a little bit opposed or not ready for it yet, but ready to get through the lab work. And once we get the labs, we sit down and take every lab value that's on there and talk about that this can be optimized and this may be causing this, and then talk about possible hormone palettes. And then we also educate with something not just out there that people say chat GPT, they ask questions, or Google, but there is also actually data that's out there that the studies are done. So we bring that up to them as well. And some people want that to take home, read and, digest and come back and ask more questions. Um,
Got it. And I kind of asked several questions when it came to the hormone replacement therapy. But are there other misconceptions that you hear kind of all the time that people think about, or maybe even myths that they believe that's just not true? Are there any common ones that you tend to hear more often than not?
Yeah, I mean, I think, and it's been covered recently in the news too. The Women's Health Initiative was a study that 20 some years ago came out, and it talked about cancer and all the risks with hormone replacement. And so then at that time, even primary care doctors who were doing some hormone replacement therapy for people had stopped or it decreased drastically. And so now they found that that was really a poorly conducted study and there wasn't accuracy to it. And that all the things we talked about already, the benefits, the cardioprotective, the how, benefits of hormone replacement, the benefits to your bone health, preventing osteoporosis, um, preventing Alzheimer's or dementia, decrease in those things, all are benefits of hormone therapy. And now they've found that so people that are replaced are actually reaping those benefits. And you can do hormone replacement for life. So this is now something that is becoming more widely known. And in the studies now, there's newer studies that have been done over these last couple of decades that have shown the exact opposite from this poorly conducted study. So I think that's a big misconception that hormones were causing more dangerous or causing cancer or blood clots or other things where they found that that is not the case.
Okay. And is hormone replacement therapy really going to be best used when people have, I'm sure it really helps when they have deficiencies, but let's say people have average levels kind of across the board, would getting additional, like still getting hormone replacement therapy, still give them an extra benefit? Or is it mostly just trying to get them to regular levels?
I think this is where it's going to be where we try to optimize. And what does that mean? It means this goes back to, again, where it's going to be subjective for that patient. Because what might make you feel great, maybe at like what falls in that average or in between the lab value, you're in the mid range, you might feel excellent at that level. Where I might need a little bit more or something. So I would need to optimize. I need to be at the higher range. So this is where it comes into when we have our visits with clients that we're going to go over the lab values, tell them this gives us some guidance, but really we're going to come back. We'll see you again in 4 weeks. We'll see you again, we'll follow up with you as we go through this progress. And maybe in that 4 week follow up, we might need to add something else or we do something else. And so we're going to keep doing something until we get to the what feels best for you. And that's going to vary really for each individual. So I think that I would want to optimize it for everybody, but what is that going to be for everybody? It's going to be different for everybody.
Okay. And so since this is very subjective, like you're trying to find that optimal level for every individual, I'm curious, what role do you believe that creativity and artistry plays in how you approach your patient care, since it's not just a factory line of, oh, just give the exact same dose to every single person. So how does creativity and artistry come into play in this situation?
It's just a individual, every person, every client that comes in through this door. I mean, it's just very individualized treatment plan. We ask specific questions about their symptoms, we look at their lab values, and also ask what are they looking as far as, after getting a treatment, what's the best that they want to get out of this, what's so important for them. It is very individualized. It's not something that it's very set. So we look at everyone.
Yeah. So I guess there is some art to it in that you are thinking of different treatment plans for each person you see.
Okay.
Supplements as well. Sometimes they might not need hormone pellets, but we can also suggest to get some supplements and be on some supplements and see them in about 4 to 8 weeks and see how they're feeling.
Okay. Got it. Now, I want to get a little bit more into the quality of the supplements, the quality of the hormones that you're putting into people. How important is it for regular consumers to ask about quality of the supplements or the hormones or whatever they're getting from a provider? How important is that? Like, is it kind of standardized as far as quality levels, or is it something that the consumers should be aware of?
I think if they should be aware of, I think consumers should go to a medical provider, somebody that has had training or experience in these treatment modalities. Go with somebody that you trust. We get our medications from pharmaceutical companies that are third party tested, so they are meet quality standards. Of course, with all the GLP-1s or other things, there's a lot of, stuff in the news about these knockoffs or people are putting things into their bodies that they don't really know. And that's a very big risk. I mean, what we're talking about is making people feel better and not poisoning them. So I don't think people should take it lightly and that they should do their research and go to trusted individuals that are using reputable sources to get their medications from. Same goes with supplements. There was, perhaps you've saw it, but like some of the supplements people were buying off of Amazon, they found were like complete knockoffs. Some of them were actually name brands that were, the labels, everything was the same, as the name brands companies, but really they were all just thrown into the same bin. And then when they tested them, there's nothing in them or very little of what said it was. It wasn't fish oil, it was all these other toxins or whatever it might have been. So even with supplements, the same thing goes. I think people need to be very cautious of where they're getting them from, make sure it's a reputable source. And not to say that Amazon doesn't have some that might sell, but you don't know what you're getting unless you're probably buying from the actual manufacturer of these supplements on those kind of platforms.
So let's say I'm like your average consumer.
Mhm.
I don't want to have to become a scientist to try and figure out like, oh, is this supplement good? Is it not good? What would you say are some of the big red flags that me as your average consumer could keep an eye out for when I'm trying to find a good provider or figure out are they using high quality, not materials, but like high quality supplements, high quality, whatever they're putting into my body? Like, what are some red flags that I should be aware of?
I think if one obvious one to me would be if the cost is too good to be true, that's probably one, right? If it's so cheap that this is like, oh, this is great. Well, there might be a reason for that. Yeah, so that would be one.
They're getting off
As far
routinely.
for the supplements, like I said, just going to the actual source of where you're getting, the actual manufacturer. Sometimes you can buy from their websites directly. I think that would probably be the easiest way for people to, because there is so much available out there now. Um, and then the other, maybe go by word of mouth. Like if it's somebody a colleague or a friend that has utilized or gotten results with this provider or through various treatments from a certain provider, that might be a cue for you, or a key factor to look at as far as what provider you choose to go see yourself. Word of mouth would be good. I know I use that on my own.
Yeah, I agree.
Now, I'm sure that you've had throughout your experience some particularly challenging cases. Is there maybe one story that really stands out of a client, a patient of yours that came in, had a really, really tough case, and really, in the end, how you were able to get them a successful outcome?
I have a client that comes to my head right now, most recent. She started with us with the weight loss, the GLP drug, GLP-1. She's about 70 years old.
Mhm.
Started with that, and then the more she was coming in, she was just saying, as far as weight, she feels great, but she feels so tired and exhausted. And she was just telling me all these symptoms.
She has
Well,
fibromyalgia. Mhm.
fibromyalgia, yeah, she gets tachycardia, her heart rate kind of increases, go up and down throughout the day, and then getting her vital signs here in the office. I can also tell her heart rate was increased, how she gets a little bit exhausted, moody. And so we talked about getting her labs, and she did her labs and then came back. We talked about, reviewed, and recommended a testosterone replacement for her, and a little bit of estrogen, and then added some progesterone. She came back to see me, follow up 4 weeks later. And as soon as she walked in, she just gave me a big, tight hug and said, I just feel great. You've changed my life. Thank you so much.
Mhm.
So those type of feedback that we get from our clients, And most recently, we also got a text message from a client that said, I love you both. Thank you so much. You guys changed my life.
Yeah, it's really life-changing for people that are feeling awful or miserable, and they just are finally listened to, and then they are treated and they actually get some results and they feel better, which I think everybody wants,
To feel great.
Mhm.
Yes.
Do you find that a lot of your patients that you help, they've tried all these other things? They've tried this, and nothing works for them, or do you find that they don't know what the issue is? They just don't feel good. They feel terrible. They went to their doctor can't find anything wrong with them, and they're just lost. Like, or do you see, I guess, both situations?
I think we see
We see
both.
both. Yeah, we see both.
Yeah, definitely
So,
both.
so if people are in that situation, whether they just don't feel good and but the doctor can't find anything, or they've tried everything and nothing's working, then this is definitely something that they should at least consider and explore.
I agree. Yes.
Yes.
100%.
Okay. Now I'm curious, where do you think that the future, I mean, we talked a lot about the kind of the hormone replacement side, not as much the aesthetic side, but I mean, where do you think the future of aesthetics and wellness is going? Do you think that they're going to be a very close marriage between the two of them?
I feel like it will be. I feel like more and more people are becoming aware of this. I think it's becoming more evident what traditional medicine is lacking. And it's not to say there's not a place for it, right? I mean, there definitely is. But I think that's where places like our business will fill this need, because I think people are becoming more aware of what they're missing by just going through a traditional path of care. And I think with the aesthetics, it's a nice fit with the overall wellness functionality. I think people are considering, longevity more, as we kind of touched on that. You want to live a longer, healthier life. You want to have a quality of life. It doesn't matter if you live to be 90 or 100, if you're miserable or bedbound, you know what I mean? So you want to be able to, and there's no reason why we shouldn't be feeling it like we did in our 30s all the way into our 80s or 90s or 100. And there are some people that feel that great. And really, all of us have that potential. And I think that's what we're just finally scratching the surface on, is that's what the future will be, is that people are going to want to be able to live this kind of quality of life, higher quality of life, feeling good about themselves as we did in our 20s, all the way into, our older age. So I think that's where medicine is headed personally.
So it's going to be about not only extending the lifespan, but also people's health span, so they can
Yes.
enjoy those longer years at good health, and they can still active and still they're not moving around in pain anymore.
Yes. And then with the aesthetic part, if you're feeling that great when you're older, you want to look good too. So,
Yeah.
so of course, it kind of goes hand in hand, as you are asking about. Yes, I think it definitely goes hand in hand.
Okay. Now, for Bliss Med Spa, what's your vision for Bliss Med Spa?
I think to continue to grow so we can reach more individuals and treat more people and help people feel the best version of themselves. So I think that's just really it.
Yeah.
I grow to be bigger, to be able to serve a larger population.
Awesome. Well, fantastic answer. I do have one last question for you, Don and Irina. But before I ask it, I do want to point people to your website at blisswellnessandspa.com. Now, the last question is, what does beauty mean to you?
For me personally, the beauty comes from inside. Um, and I feel if you're feeling great from the inside, physically, emotionally, you feel great and beautiful outside.
It's going to be
Yeah.
seen in your aura. People are going it's going to radiate from you, and those people around you will see that. So I agree. Yeah.
Some, well, wonderful answers. There you have it. Irina and Don sharing their expertise. So, where can people contact you in your practice?
They can call us or they can see us our website as you mentioned, and then I can also share a phone number, which is 602-880-8777.
Okay, wonderful. Well, this was a pleasure. Thank you both for coming on the show, sharing your expertise, and dispelling some myths when it comes to hormone replacement therapy.
Thank you.
Thank you for having us.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.